This is SmartHIV PRISM, fully web-based, running entirely on Bohemian Smartlytic's own simulation engine, developed from the ground up. No third-party software underneath, no external licenses, built in-house from the ground up. What you're looking at is a global digital twin of HIV services. Select any country, and the entire back-end reconfigures around that health system's own parameters, its own patients, its own service structure, adapting instantly to reflect how care is actually delivered there. Every service customizes its own demand inputs: existing patients in care, new patients expected through referral, people at risk of HIV being offered PrEP, and how many years forward to simulate. Throughout, current practice is always run against a comparison scenario, so nothing is assessed in isolation. Cost parameters follow the same logic: antiretroviral therapy costs, second-line therapy, laboratory costs, staffing, and overheads, all configurable to reflect how this particular service actually spends day to day. From here, the entire service is defined in detail. Patient attributes. The split between prevention services, pre-exposure prophylaxis, and post-exposure prophylaxis. Antiretroviral therapy costs class selection. Treatment timelines, monitoring visit schedules. This level of detail matters because it's what lets the model capture the full patient journey, from prevention, through treatment, through ongoing monitoring, not just a single point in that journey. Human resources are configured next, making sure every resource type, doctors, nurses, counselors, pharmacists, is properly assigned to patients at the actual point of care. And now it runs. This is an AI-powered digital twin technology simulating the HIV care pathway, thousands of individual patients moving through prevention, treatment, and monitoring, with every visit, every delay, every resource constraint tracked in real time, while also predicting risk using machine learning algorithms, such as loss to follow-up and hospitalization. It's true discrete event simulation, not a static average, and that's what makes the results that follow genuinely reliable. We start with service demand, patient type, adherence, deaths, discontinuations, visit volumes, a full breakdown of activity, current practice set directly against the tested scenario. Here, an increase in PrEP uptake among key populations, including men who have sex with men, sex workers, and transgender individuals. The human resource dashboard shows staff requirements against both existing and unmet demand across the entire workforce. This is where workforce planning becomes concrete, seeing exactly where shortages sit, where there's excess capacity, broken down by every individual staff type. The prevention dashboard shows what that PrEP scale-up actually delivers: cases averted, visit volumes, drug costs, cost-effectiveness, and the underlying health economic analysis. This is where the platform moves beyond day-to-day operations into genuine health economic outcomes research territory. Evidence pharma and payers can both use. Finally, the budgeting dashboard shows the financial picture: cost broken down by patient type, age, and expense category. And because the scenarios are limitless, this example models a new product launch, PrEP, but the same approach applies to any intervention. And SmartHIV PRISM isn't limited to a single service. The same model runs at national level, regional level, or state and city level, one platform, any scale.